Hello, I'm Dr. Gayatri Pandit Rao, and today let us give a second thought, towards cervical cancer and its prevention. Now, why I'm saying let us give second thought is because in today's health, if we see, the strategy is most inclined towards is prevention, and we do less talk about treatment protocols and all. So whenever we say that prevention is better than cure, I would rather now feel like saying that we should all start questioning today's science, that is this phrase used is always true, and should we use it rather in public health at large? Because why we talk about prevention usually is when we have certain kind of fear, or we have certain kind of apprehension, or there is some probability, that is chances of getting infected by some kind of virus or being affected by some disease. So here, if we see the overall picture, we all know that cervical cancer, the main cause is said to be the virus, which is again HPV, that is human papilloma virus. It has again its subtypes and the strains, and most likable strains causing this cervical cancer is the 6, I think 10, 16 and 18 subvariants. So the transmission, how it occurs, is said to be passed on from one to another through sexual contact. So next step that comes usually is determining the risk factors, the prevention strategies. Now, I would like to stress here the fact that considering our Indian culture, okay, because here we are talking about HPV vaccine, which is going to be, given to population in near future. So we have to think about our own terrain. So our Indian culture, if we see, has less chances of age groups, in early teens and all, to really become sexually active. So now, if we see the probability of this disease picture, what is usually noted is that cervical cancer statistics has also proved that this is very rare in young people, especially below the age of 20 years old. And mostly, when it is diagnosed, is mostly in the age between 25 to 35. And in US, mostly, I think the average age of being detected by this virus or getting disease affected, that is being cervical cancer, is around 50 years, and 20% and less are diagnosed above age 65 also. So if you see the statistics and overall probability, the preteen, or you say the age group which is going to be considered as 19 to 14, or say 15 to 20, this age group doesn't fit this scenario at all. So considering something which is going to happen in very far future, and trying to prevent it by giving vaccines which themselves have certain issues, like, see, how there is always shelf life for vaccines, isn't it? Then you have the efficacy, so how efficient the vaccines are going to work for how long period. So consider a scenario wherein you inject a child, a girl, say 12 or 13-year-old, with the probability that she might get affected by the HPV virus in her late 25. So what are the chances that the HPV vaccine is going to protect her after 15 to 18 years, or even more than 20 years after being given the HPV vaccine shot? So this is very important to be considered, I feel. So anyways, our Indian culture do not permit even this age group children, I could say, being sexually active. So the risk factors, or the age group, or the people who can come into this category maybe can be thought of, about sex workers, or people with like LGBTQ, etc., and lower socioeconomic class, then uneducated people. So, or even, who are people who indulge in polygamy and all. So, there are some risk factors as far as age is concerned. Then there is variable scenarios, like where you are located. So this is into Asian culture that we are talking about. Now, if you see Gardasil, a vaccine which was, it was halted. The vaccination campaign was halted in Japan for nearly 5 to 6 years, and later it was thought again to reintroduce. But we need to see that why at first it was halted. It was because of the adverse effects that were being shown by Gardasil. And on the same line, actually, the Serum Institute is onto its way to produce its vaccine, that is Servavac. Now, before going to the Serum Institute thing, another thing what is important to know here is it's not only about prevention by using vaccines. There is another way that can help, in preventing this cervical cancer, and that is the screening. Now, screening, why I'm saying is better, because the early detection can take place of the virus, of HPV virus. And also one thing is important to be noted, that actually this cervical cancer is quite curable as well as treatable, even if detected in first or second later stages. So only downside about this screening again issue is that if we screen too much, too much screening also is a flag. Some researchers have even went ahead to state that because of too much of screening, what is happening is we tend to overdiagnose it. Because of overdiagnosing, there is a large probability of showing that so many people have been affected because of the screening, because there is chances of false positives also, and again which leads to vaccination again. So another important point here to be noted is that Serum Institute, now I will like to talk here something about Serum Institute. Serum Institute actually had started its clinical trials. The second and third clinical trial, if I am not wrong, as per the reports, was started in somewhere late around 2018. Now, and it was supposed to be monitored for next 3 to 4 years. But strangely, if we see another angle to it is, after 2018, that is 19, 20, 21 and 22, if we consider last 4 years, these clinical trials of HPV vaccines very much coincide with the vaccines given for COVID, that is Covishield. So it is, one can think that what effect this multiple experimental vaccines can have, onto each other, and what can be how one can weigh this trial outcome. So that is also very important. Then last month, that is in May 29th, 2023, a subject expert committee that we call SEC, who advises usually the Drug Control Group of India, has asked Serum Institute to provide, the revised clinical trial protocol and then further it will be considered. Now, when this happened, when Serum Institute actually submitted their proposal for grant of permission to be conducted on the fourth clinical trial. So this is quite strange that a company is giving a proposal for fourth clinical trial wherein the third clinical trial itself has some doubts. So, if today also if one goes on the website, website has not provided any information on HPV as such. Like, what are the trials done, or what is the composition of the HPV vaccine, or the FAQs that comes along with it. So nothing is there on Serum Institute official website. Only the name appears just as a product lineup, which is Servavac. Now it has already been launched. So, with this very much incomplete public information, it is very highly objectionable to question, its implementation of this HPV vaccine for preventing the cervical cancer, which is again a chance, and implement going forward, and implementing it into the National Immunization Programme is very, very objectionable. So also, vaccines can and should never be mandated, even as per Supreme Court orders we know, and no vaccine should be given without any informed consent. So again, about the side effects and adverse events that occurred during clinical trials are not much known, and which have been known where addressed like by countries like Japan. So here in India, I feel that including this HPV Servavac vaccine for prevention of cervical cancer and including it into National Immunization Programme should absolutely be halted and stopped, and we should really think over the different kind of prevention strategies apart from vaccinations, because I, being a homeopath, we very much believe that vaccination is like you are injecting a virus or the disease element into a healthy human being who is already healthy. So the chances of even you getting prevented by certain strain of HPV is not nullified. You can, even after you get vaccinated or even after you screen yourself, there are chances that you may still get cervical cancer, because even in screening, some cell membrane changes can be skipped. There are chances of false positives. Then overdiagnosing leads to over unharmful implementation of treatments like chemo, radiation. We all know the side effects of all these treatment protocols also. So considering the conclusive point here, I would state, looking at the disease picture or the probability, or we say the chances of anyone of age group between 9 to 20 getting affected by this HPV virus is very rare, and hence this HPV vaccine Servavac or whichever will come in line should be prevented for implementing it into National Immunization Programme. We should not give it on a mass scale, because we are yet very well unaware about the adverse events that it may cause, the short term as well as long term. And even if the 1% chances of adverse event, but nobody knows who that 1% will be. So it is better to avoid these into mass vaccinations, and one should, I feel, look over the risk age groups, and they can be finally vaccinated depending upon their total health scenario in future. Thanks.